we also go by Advantage Aging Solutions. I'm facilitating, so I will pass it along to the actual speaker today, Giovanni, also by Gigi, O'Neill, and she can tell you a lot more than I can, so we'll get started.
What was your name again?
My name is Heather Kerwin.
I've seen your emails. I think I've emailed you.
Good evening.
I work with APS up in the Northwest region.
I probably run across you. Good to see you in person.
You're like, do I need to hide?
Right. I'm like, I got outside pretty quick. I know the evacuation now. I know I need 2 more tickets. Did everybody get a ticket and evaluation form besides this last 2? Okay, I'm gonna run out and grab that.
Worries are so much.
All right, good afternoon, everyone. So my name is Giovanni, but no one calls me that professionally. I go by Gigi O'Neill. I am a senior learning consultant for Centene Corporation in the state of Florida. We have subsidiaries such as Sunshine Health. Woo-hoo. All right, Sunshine. All right. Any WellCare folks in the house?
No.
Well, whoop to them too. And Better would be another one of our subsidiaries involved. Can't think of any other names right now. However, I am with Centene Corporation. Centene's in the house.
Yay!
So for those of you that are not a part of the Centene party bus, no worries whatsoever. We are completely and totally inclusive around here. So this presentation, first and foremost, thank you for coming, especially after lunch. I appreciate it. I know how much you want to learn about this if you still stayed after the fire drill and lunch. So I appreciate each and everybody. Thank you. So welcome to Optimizing Care Management for Members Living with Dementia. Normally I stand when I facilitate, but I am afraid that I'm gonna fall. We witnessed a couple of falls outside, or one fall and some near falls. So I'm just gonna sit. They were okay. She ended up walking away. Sat down, but yeah, it was fine. But I don't want to fall, so I'm just gonna sit. And if for whatever reason you can't hear me, please let me know. I will project a little bit louder if I need to. If you find that I'm speaking too fast, I get very passionate, very fast, very quick, I just get excited, please let me know to slow down. Sunshine Health folks, they know my spiel. Centene folks know my spiel too. But for everyone else, feel free to tell me, hey, Gigi, you're speaking too fast, or I can't hear you, and I will do my thing. All right, so optimizing care management for members living with dementia. So let me get into a little bit more about who I am. So I told you I was a senior learning consultant. My career spans nearly 20 years. Next year will be that 20-year mark of professional work. My first 10 years of my career was in case management of older adults and adults living with disabilities. From there, this latter half of my career, last 10 years, has been in learning and development, primarily with managed care organizations. And I'm also a registered nurse. However, I do not practice, and I consider myself to be a theoretical nurse. So anybody passes out or anything like that, I can help you in theory. So let's not have that happen. There's only so much that I can do. All right, so with optimizing care management for members living with dementia, this presentation is primarily about a project that I received last year to help implement a dementia care specialist training program for some of our case management or care management staff members. All right, so here are the objectives. So if I do everything right today, hopefully I will have explained the need for an employer-sponsored dementia care certification program for care management professionals. Hopefully I will have described the roadmap for creating such a program, and then we're going to get into how this program has influenced some of our members. Here's the agenda. So we're going to do a quick overview, followed by data and feedback. Then we're going to sum up everything, give you some references and let you know that I'm legit. And then we're going to do Q&A if you have any questions. All right, so here's that overview as I promised. All right, so Centene at a glance. So I mentioned Centene, I mentioned Sunshine Health. Ambetter, Allwell possibly involved. Those are some of our subsidiaries. So all in all, Centene, managed care organization, we believe in transforming the health of the community one person at a time. So you may hear me say that more than once. The statistics that you see on the screen, this was as of March 31st. It's since been updated. I think we received an email yesterday about some of this stuff changing. So the Fortune position may not be quite correct, but as of March, we were 26 in the Fortune 500, and then 66 in the Fortune Global 500, and then around March we had over 67,000 employees, but I think now we're close to 68,000 or a little over that. We serve 1 in 15 individuals. We have 28.5 million managed care members, and once again, that's as of March. We serve products or service products of Medicare and Medicaid, as well as Marketplace or the Affordable Care Act plans. 16.3 of our members are Medicaid members, followed by 1.3 million in Medicare, 3.1 for those Marketplace members, and then last but not least, 4.5 million for the prescription drug plan members. And once again, this was as of March of this year. Now, as far as transforming the health of the community one person at a time, that's our purpose. That is what we believe in. That's why we are in the business. At Centene, we have a saying, we are all one Centene. So it doesn't matter the subsidiary that you come from. You know, that's why we did the little shout outs earlier. We are all one Centene, transforming the health of the community one person at a time. Our missions are better health outcomes at lower costs. And our pillars, we like to focus on the individual, whole health, as well as active local involvement. We're very big on person-centered care. And I know in the state of Florida, person-centered anything is really, really big. And Centene, we are all about centeredness. So our beliefs, what drives us? We believe healthier individuals create more vibrant families and communities. We believe treating people with kindness, respect, and dignity empowers healthy decisions. We believe we have a responsibility to remove barriers and make it simple to get well, stay well, and be well. We believe in treating the whole person, not just the physical body. So once again, that person-centered care, holistic care, really big into that. And last but not least, we believe local partnerships enable meaningful, accessible healthcare. All right, so got my bio out the way, got Centene's bio out the way. Now let's get into this presentation. But first, we have a little activity. So this is gonna let me know who's all in the room. Helps frame the conversation a little bit, or this presentation. So what do you all know about dementia? And this is not a rhetorical question. Feel free to answer. Just helps me know where we are in the room.
Multiple types of dementia.
Yes, there's several different kinds. Alzheimer's, if I'm not mistaken, is the most prevalent. We have frontotemporal, vascular dementia, Lewy body disease. There's a long listing of them. Okay.
96.
I'm sorry, go ahead.
So there are about 96 of them. So yeah, you
Yes.
would be looking for it.
Wow.
Yes.
A lot. So I've been serving people with dementia for 31 years, so that question would be a bit broad, but just
No,
so
no.
fairly in depth of my familiarity.
No
If you're wanting to
problem.
get to know the room, I don't.
No, thank you. Thank you for that.
Sure.
And sundowners is a real thing.
Yes, it is. I've had several relatives who have had dementia experience sundowners, and I have one right now who is going through sundowning right now, unfortunately. So sundowning, for those that don't know, sundowning, best way I would describe it is around the time that the sun goes down, or 5-ish, 6 o'clock-ish, whatnot, you'll notice that there will be some behavioral changes in the person living with dementia. So this could be some disorientation. They may feel like, I have got to leave, like it's time for me to go, or their mood might be different. They might get upset more, or easily more aggravated, agitated, things of that nature. All right. So, according to the Alzheimer's Association, dementia is a disease that causes the loss of cognitive abilities, and it severely impacts activities and instrumental activities of daily living. All right, so next up, how many of you all, and you can raise your hand for this, how many of you all have a loved one or had a loved one who lived with dementia? All right, so that's the room. All right, put your hands down. All right, next question. How many of you all have worked with someone living with dementia and their family? Okay, so that's also most of the room. Okay, so right crowd, and even if you didn't, you would still be in the right room. All right, so nonetheless, last question. How important is aging in place to you, your family, your friends, or your clients? So aging in place, according to the National Institute of Health, this is the ability to age in the home of your choosing, or to age in a private residence of some sort. So for you all, is aging in place important, whether you have dementia or not? Okay, so I see a lot of head nods. Great. So when it comes to those persons living with dementia, a lot of times aging in place is key to behavioral management. So sometimes persons living with dementia may have some challenging behaviors that caregivers find difficult to managing. However, studies have shown that the more a person is oriented to their place in person, that can help manage some of those behaviors. So in other words, routine. The more they have routine, the more they have familiarity, the more they're likely to age in place, or at least in the least restrictive environment. And for our members with dementia, that should be something that we strive for. Because at the end of the day, everybody wants to age in place. They want quality of life, quality of care. And just because you have a particular condition that is difficult at times doesn't mean that you should not be afforded the opportunity. Okay, so now that's going to bring us to dementia care in the United States. So as of 2018, over 5 million older adults were living with a diagnosis of dementia. In 2020, the estimated healthcare cost for treatment of Alzheimer's disease was estimated at $305 billion. And then the number of people living with dementia is expected to increase to 16 million by 2050. On top of that, the United States workforce is experiencing shortages in medical staff who can actually work with those members living with dementia. And that's not to say that you can't have a doctor or a nurse or a social worker or anybody work with them. It's just that when it comes to certain diseases, you do want that provider to be familiar with the disease process. So for example, I am a registered nurse. However, I gave you my spiel earlier. I am a theoretical nurse. Please don't pass out in here. Just because I'm licensed as a nurse does not mean that I am equipped to help you like that. I do not consider myself to be a SME, or subject matter expert, in just random emergency care, if you will. So the same would be true for dementia care. So a lot of our medical professionals, beyond what they learned in medical school or nursing school or when they were getting their social work degree, if they haven't been exposed to any other practice of working with someone with dementia, all they might have is just that knowledge that they learned while they were in school. So when it comes to dementia care, you want someone who is qualified, someone who is knowledgeable, because it's not just necessarily about treating the disease process. You want to treat the person holistically, as well as help their family members to continue to care for them. When it comes to dementia, the disease is very progressive in nature, and you will a lot of times have family members who are experiencing a living death. So with the living death, it's them basically losing the person that they knew, knowing that the disease eventually they will succumb to the disease. They're watching this person that they love, lose their ability to recall, lose their ability to carry out basic functions, things of that nature. And so what you would suggest for someone who's possibly, let's say they're struggling with a mental health disorder, and they might have challenging behaviors, the same suggestions may not work for the person living with dementia, because at the end of the day, this is a neurocognitive disorder where we have some physiological things that are happening and possibly some emotional and mental health things happening too. So the way we approach it would be very, very different than how we would approach, let's just say like a general mental health disorder. All right, so moving on. So that brings me now into dementia care coordination. So in order for care coordination to be effective, or we really do need those dementia care subject matter experts, which we'll speak about on the next slide. So effective service coordination leads to decreased care costs, including utilization management of services. It also delays institutionalization. Once again, we want to have our members age in place as best as we possibly can have them, because it just helps with the quality of life overall. And last but not least, and I guess I kind of said it, so not last but not least, but continuing on, it improves the quality of life. So as I said before, everyone should have that opportunity to age in place, or at least in the least restrictive environment. So how do we do that? Dun, 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 dun. So we have dementia care specialists, right? So a dementia care specialist, this is a subject matter expert on dementia care that primarily supports care management. However, they can support other departments, other teams, other areas of business. It just depends on the business needs of the organization. So dementia care specialists have been proposed as a workforce solution to help caregivers with that effective service coordination and referral. So your dementia care specialist is part care coordinator, part disease educator, part behavioral management strategist, and part community resource navigator. This role may be clinical or non-clinical. It just depends on the agency or how the care management team is comprised. Now, to be a knowledgeable DCS or dementia care specialist, Centers for Medicare and Medicaid have defined that these are the areas or the KSAs that a dementia care specialist should have. So they should have an understanding of the global features of dementia, symptoms and disease progression, management of challenging behaviors and communication problems, management of caregiver stress and caregiver needs. So it's not just the person living with dementia, but their support persons, their caregivers as well. They are also included in this care plan, or the knowledge and skills area, or KSA. And last but not least, they should have knowledge about those community resource referrals. So Centers for Medicare and Medicaid, or CMS, they have also recommended that if you were to have such a role in your organization, that in order for them to be considered a subject matter expert in dementia care or a dementia care specialist, they would need to undergo an extensive amount of training, at least 20 hours worth of training, two-tiered, where it's broken up into basic information versus advanced knowledge. Okay, so knowing that, Centene was like, hey, that sounds dope. We should do that too, because you know what? We transform the community one person at a time. And this falls into our person-centeredness, and it's gonna help members age in place. So Centene, we eventually partnered with Johns Hopkins to create a dementia care specialist certification program for our care management staff. So we do have a couple of lines of business where they are required to undergo such a training. And based off of research completed by the University of California, San Francisco, that's a lot, so we'll just say the college in California. Based off of some research that they did on dementia care specialists in the workforce, Centene Corporation said, hey, we want to model this for our health plans that are required to have dementia care specialists, as well as our health plans that would like to employ or make sure that they have dementia care specialists on their team. So we partnered with Johns Hopkins University, which is considered America's first research university according to their website. They're based out of Baltimore, Maryland. We partnered with them because we were already working with them on some other projects. Johns Hopkins has a program called Mind at Home, and some of our subsidiaries, they participate in that particular program. So Johns Hopkins, being that they are a leader in research on dementia care, is like, hey, why not? We already have a partnership with them. If we're going to do this, let's do this right. Let's make sure that we have evidence-based practice. And so in the next couple of slides, I'm going to go over our roadmap as to how we got to implement such a program. Okay, so back in sometime in the spring. And the reason why I say sometime in the spring, because I believe our staff members completed a similar training at different times, but we had 4 care management staff members complete a similar dementia care training specialist program in the state of California. After they completed it, then once again the leaders were like, hey, this is great, we had some people complete it, okay, let's see if we can get our own thing going, so that way we can go ahead and get more DCSs versus having to wait for them to go through training from an external vendor. All right, so then in May 2022, some team leaders gathered existing content options. So existing content, this would be things that we had within our own learning management system, as well as trainings available out in the world. So I know Alzheimer's Association has extensive content available for dementia, and I think a couple of other entities have extensive content available. So some team leaders started gathering content, and then eventually they ended up contacting Johns Hopkins University because we had already partnered with them. Then June 2022, that's when I get involved. I was summoned to be the project coordinator for this particular project, and we completed our content crosswalk. So with all of the content that we had, somebody had to go through it, and so that was me. I looked at all of the training content that our leaders gathered, and the reason why that was done is because I was tasked with, hey, we want this program, but we also want it to be evidence-based and current. So with all of the options that were given to us, I basically reviewed every single last option, checked to make sure that they were current, not current, met certain components. And when I say certain components, if we go back, these were the components that we were looking at for this training. So had to speak to the global features, symptoms, how we manage the behaviors, caregiver supports, as well as community resources. So once I had that crosswalk, it was determined that Johns Hopkins was still the best curriculum designer of content, so we opted to go with them. And by the July 2022, Johns Hopkins was selected as the curriculum designer, and then from there we implemented our project plan. All right, so then September 2022, the DCS, or Dementia Care Specialist, so when I say DCS, that's Dementia Care Specialist, the DCS facilitators were identified, because now it's like, okay, it's go time. We want to get as many staff members trained as much as possible at the end of the year or the last quarter of 2022. So we identified our facilitators. We then immediately began our Train the Facilitator sessions with Johns Hopkins. And then the quarter for 2022 facilitation schedule was created, and then our content was finalized. By October, our initial learner audience was assigned their e-learning content. We had our first instructor-led session completed by Johns Hopkins, and then we began our transition plan from Johns Hopkins to Centene. So in the beginning, Johns Hopkins, they created the content and they also taught the content for us. So our first couple of classes, whoever got in those classes, it was an amazing feat to see, because you had these Johns Hopkins doctors who were training content for us, and then eventually they phased out, and then by November 2022, we took over completely. All right, from there, December 2022, we then finalized the content was finalized within our learning management system. We use a system called Cornerstone, so got everything in there. At the end of the year, we ended with 79 dementia care specialists and 5 facilitators. So although these numbers may seem relatively small, the hours that these individuals completed within such a short amount of time was phenomenal. This was close to 20 hours worth of training that we had individuals, they started in October and finished by December 2022. And mind you, they kept their caseload, their current caseload. So that's a feat within itself. I know it, like I said, it doesn't seem major, but at the time it was just like, oh my God, we have, almost 80 people. That's great, because no one had a decrease in their caseload. No one had extensions, things of that nature. It's like we had these people. It's like, hey, they got to get trained before the end of the year, and they did. All right, so then January 2023, we began our instructor-led content revisions, and you may be going, Gigi, why would you need to revise content? Well, in the learning and development world, that's what we do. We revise content. You want to always make sure that content is up to date, current, and relevant. The content that we received from Johns Hopkins, as beautiful as it was from them, filled with glorious information from medical doctors, it was written in a way that it was hard to digest for our working care managers. So we had to then basically revise some of the slides so that way they were adult learning theory friendly versus what I like to call college theory friendly. So we started those revisions. All right, so then by the spring, we then began our transition plan to our disease management facilitation team. And as of now, or August 1st, we are still within our pilot year. We have 263 dementia care specialists, including now 8 facilitators. All right, so our learner audience. Okay, so we have a required audience, and that required audience would include our Medicaid care managers and program specialists, along with our Medicare care managers and program specialists. We do have an extended audience, which would be basically anyone within the Centene Corporation umbrella. They are more than welcome to take the curriculum. However, they have to get approval from their people leaders due to the amount of time that it takes to take the curriculum. And just in case if you're not familiar, which I believe everyone is, but Medicaid is basically a federal program administered by states that provides health coverage to children, low-income adults, older adults, people living with disabilities, and pregnant women. And Medicare would be a federal health insurance program for those adults who are 65 plus, certain younger people living with disabilities, people with end-stage renal disease, and then what we consider to be a care manager or something similar to that role. This would be our primary point of contact for our members. They typically do some sort of comprehensive assessment and they coordinate care. A program specialist would be a secondary contact for our members. They typically do screenings, interventions, and possibly some referrals. All right, so we are not really halfway through, but just want to check on everybody. How's everybody doing? I know it's after lunch. I know it's tough. I know I sound like I work on the radio sometimes, and it's soothing, but let me know if you need a stretch break for like a minute. We can take a stretch break. All right. So our facilitators, all of our facilitators and potential facilitators are staff members of our learning and development team. So in the beginning, when with our original grouping of facilitators, we started with some nurses, including myself, a social worker, and an educational professional. Reason being is because, once again, with Johns Hopkins leading off the content, it was coming from medical doctors and I believe one research doctor. So our team really wanted to make sure that as we were transitioning, like, hey, can we hand this off to some individuals who happen to be licensed, registered, something, so that way it makes sense for the audience, okay? So we started off with one LPN who was a Medicaid subject matter expert. We had 2 registered nurses. I was the long-term services and supports and Medicaid waiver SME. We had 1 nurse who was a Medicare SME. We had 1 licensed clinical social worker and behavioral health specialist who was also a behavioral health, I'm sorry, I said that wrong, behavioral health SME. And then last but not least, we had 1 educational professional who was a certified educator and a Medicare SME. So to date, we now have, I think, approximately 8 facilitators, 13 who are still in the process, with 2 here, whoop, whoop. And for facilitation, we don't necessarily require that anyone be a licensed professional. It's just in the beginning, from that handoff, it made things a lot easier. All right, so now we're gonna get into the curriculum. So the curriculum is 2-tiered, where we have advanced dementia care information as well as basic dementia care information. And we have this broken into e-learnings as well as virtual instructor-led learning sessions. And our curriculum is approximately 19.5 hours worth of content. All right, so the e-learnings, the basic. So the basic course will have an overview of Alzheimer's disease and other dementias. We go over some cognitive screening tools, some best practices for behaviors, as how to assess and address safety, as well as caregiver support and community resources. The duration time for this course is about 6 hours. Then for the advanced e-learning, we go over health disparities, challenging behaviors, dementia caregivers, person-centered care planning within dementia. And for those of you who are from one of our subsidiaries, when it comes to the care planning, this is not necessarily, we don't speak to a particular documentation system. So this would not be care planning within True Care or virtual health or whatever the documentation system is. This is strictly person-centered care planning theory and not a particular document. The duration for that is 4 hours. Moving on to the instructor-led courses. So the part 1, this includes advanced dementia information, cognitive screening tools, addressing and problem solving for challenging behaviors. We have small and large group activities. It's offered twice a month. The duration is about 4 hours, and a class can hold up to 30 people. For the part 2, we provide advanced dementia information on caregiver support, care planning in dementia, which is basically theoretical care planning within dementia, common issues with disease progression. We have those small and large group activities. It's offered twice a month. It's also 4 hours and up to 30 learners. So the first 4 classes that I mentioned were all written by Johns Hopkins University. And then our last class, this was an in-house class from the Centene Learning and Development team. It already existed. This class is called Neurocognitive Disorders. This provides definition and identification of neurocognitive disorders, the causes, goes over the functional area impairments, treatment approaches. It's offered twice a month, and it's about 1.5 hours, and that has a max of 200 learners. All right, so now we're gonna get into our data and feedback. So as I said before, we are in our pilot year. So from our, we give out pre-surveys and post-surveys. So this data comes from those surveys. So a majority of our learners, they do either support or reside in the state of Florida. They also support the Medicare product. They're considered care managers. Most of them are nurses. Most of them have 11 to 20 years of experience working with older adults, and most of them have 1 to 10 years of care management experience overall. Most of them have an approximate caseload of 51 to 100 members, and 1 to 25% of that caseload has a diagnosis of dementia. All right, so to date, we have 263 members who have completed the curriculum, and we have 50 individuals who support or reside in the state of Florida. So what are people saying about this curriculum? So what we see on the screen, this is from our subjective feedback. So we could do the the pre-surveys, the post-surveys, and then they get an evaluation about the course overall. So that's where this data comes from. So what I did was I took all the subjective data, found themes, common themes, and these were some of the words that were stated over and over and over again. So excellent, discussions, goals, encompassing, things of that nature. And then from the post-surveys, most of our learners stated that they had an increase in knowledge related to dementia care, followed by an increase in knowledge related to caregiver support practices. And they also had an increase in feeling very capable of working with members living with dementia. So once again, that's very important because, like I said, if you're not familiar or used to working with a person living with dementia, it might be challenging. All right, so we're gonna get into some of our testimonials. All right, so this is from one of our care managers, and she says, the dementia course enhanced my knowledge on dementia and the phases of dementia. In addition, the dementia course has increased my comfort in providing education and referral services to prevent or close gaps in member care. Then we have a care management manager. She states, being a certified dementia care specialist has provided me with the knowledge and skills to effectively assist members who are experiencing symptoms affecting memory, thinking, and social abilities. These symptoms interfere with our members and their families' daily lives. Having the knowledge and skills helps provide education, support, and improves the quality of life one member at a time. This is from a DCS stakeholder. She's a case management staff vice president. She says, research has shown education and training can help staff to feel more confident about dementia care and improve their knowledge and skills, which in turn can lead us to provide better care. Our frontline care staff need to understand the impacts dementia has on our members and their caregivers' life. So we provide person-centered care and support. Sometimes people need support to express their memories, thoughts, and feelings. Finding the right supports for people with dementia and those who love and care for them can make a big difference in their quality of life. All right, so now we have some live facilitator testimonials. So I'm gonna hand it off to Elena.
Absolutely. No, I'm gonna do it from here. Hi, everyone. Hi. I am so proud to be a part of this program. Some of you know me as a Sunshine Health Senior Trainer, but I am also part of Centene, the specific of Population Health.
Population Health and Clinical Operations.
Yes, PHCO. I'm part of the DHLD, Behavioral Health Learning and Development. And I have been with Centene Corporation for 10 years. So I want to say quickly how exciting it is to hear you, Gigi, present on this program. I have myself the opportunity to navigate as an attendee to this program and become certified as a DCS, and also then was granted the opportunity to be trained as I'm in the process of being trained as a facilitator. So I actually, in thinking about this, took some notes for myself and wanted to share with you all. One of the things that I found to be a great highlight of this program is how it builds the participants' empathy for working with those who are diagnosed with dementia. And the videos in the online component, the opportunities to participate in the breakout sessions, the engagement that as a facilitator I get to do in delivering the content and allowing people to come in contact with the content and reflect and also think about different variables influencing different situations, talking about challenging behaviors. All of that is really strength. Are all strengths. To me, the first thing that caught my eye was the empathy. But the other thing that I do want to say is that I think that this program not only informs its participants, but really creates a perspective of care, of how to deliver care, how to best support the caregiver. There's some videos that the video about how to communicate a diagnosis. You get to experience sort of that in a video. You see from a caregiver perspective what it is when your loved one keeps asking the same question over and over and over and over. You see a video in which you see a woman and her son, and he's assisting her with just walking through the neighborhood, but she's really experiencing perceptual challenges. She's having all kinds of challenges, and so how they navigate that, the opportunities to learn about cognitive screening. I think this is a great program. From my participation perspective, as well as a trainer of it, I think the opportunities that participants are given to meet in the small groups and go through the activities really support the delivery, the skills training for the care delivery, looking at all the aspects of a scenario and discussing. And of course, one of my favorite parts is when we get into the challenging behavior section, which at times poses a lot of questions. How do we deal with the challenging behaviors? Not only from a care perspective, but also from a family caregiver perspective. So it really equips people to have those answers. I have enjoyed it very much, and I thank you, Gigi, for this opportunity.
No problem. Thank you, Elena. All right, moving on to Sharon.
Sharon Sykes, I'm elated co-worker and all of that. I agree with all of that. 100%. I'm also a clinical provider trainer and representing Sunshine Health today, but I also work for Ultimate, I'm on the umbrella of Centene. Well, what I want to add, just a couple of things. I am also a licensed clinical social worker, and I'm a certified case manager, and I've been in the field over 20 years. Why that is important when it comes to this, and I actually train on understanding the basis of dementia. Going to this really and truly only enhance what I already know. I want to speak to those that might have been in the field for a long time. It's like, well, what else can I know about dementia? This training, seriously, it really takes us back to some great research that's done by John Hopkins, and it goes from the basic all the way to really helping you not only to be able to facilitate it, but also to help those members a better understanding. So I just think it's about putting some extra stuff into your toolbox, and it is really, really great. And just one last thing, like I said, I agree with everything with Elaine. I dealt with that, but it's so interactive. Now I have to tell y'all, my truth, right? My truth. I was like, 20 hours, are they serious? I'm like, oh my goodness, I know this is gonna be boring. And I'm telling Gigi, it's excellent because she was with us. It's so interactive that you will not be bored. And so I just think of just giving that opportunity, if you're really gonna, being a part of the Aging Network, I really think it's great, for me to go through the training, but also to be able to facilitate it. So that's just.
Let's give it up for Elena. Thank you so much for those testimonials. Yes.
Yes, so who can take the class? That was the reason, one of the things I wasn't clear about. You mentioned Medicare and Medicaid employees,
Right,
case
so-
managers, and then Centene employees.
Right. So basically the training is internal to our organization. So we have health plans that service Medicare and Medicaid, and it can be a variety of health plans. Those are typically what we consider our required staff that have to take the class. And then we also have departments outside of those Medicaid care management teams or Medicare care management teams that are also able to take the training as well. So this would be our utilization management team. There is no requirement whatsoever for anyone in the UM team to have to undergo this training at our company. However, if one wanted to, because it supports a business need or maybe a professional goal, if they get it approved by their people leader, then they're able to then register for the course.
Approved by their who?
People like their supervisor or their manager.
Okay,
So
so
you're saying
we,
that people outside of Centene can't utilize or apply this information?
No, not at this time. So that's something that's been in the talks, in discussion, and actually with our clinical provider trainers. So not at this time. It's not external to Centene. Yes.
How much, in this program, I know you've got the facilitators, you've got the dementia care specialists, how much training do they give to the caregivers? And is there like a little mini version of this that they provide for the caregivers?
So for the caregivers, it depends. It really depends on the health plan as well as the particular program that the loved one is under. So under some programs, caregiver training is a covered service and is something that someone could, potentially receive. But it depends as far as this in depth of a class. I don't know if the caregiver training is that in depth. I know that there are some health plans that will provide basic high level overview type things on disease processes, things of that nature, and then the other classes that kind of go along with it is more so trying to think like skills like how to assist in giving someone a bath. Yeah, AD, thank you. I couldn't think of the word. So
Getting them to take a bath.
Right, right.
That's the biggest issue we run into with APS is caregivers trying to get them to take a bath, and that causes problems.
Right. So it depends on the health plan and the product or the program that the member is under, where caregiver training may be a covered service. And typically, if caregiver training is a covered service, then it's usually provided by one of the local partnering home health agencies. Any other questions? All right, last but not least, we have a dementia care success story. So as I said before, we are in a pilot phase of this particular program right now. The names have been changed to protect our members. This is not a member from the state of Florida. So when I read the story, you'll probably go, oh God, they got services quick. This is not the state. This is a different state altogether. in March 2023, our member Vanessa, an 84-year-old female who resided in a private residence, showed up on an area agency on aging report, that's so hard to say, AAA report, for having a diagnosis of dementia. The program coordination team contacted Vanessa. She agreed to care management services and a referral to the AAA for Medicaid waiver services. Once again, this is not Florida. So, all right, so within a few days, Vanessa's DCS or Dementia Care Specialist care manager, Mateo, contacted her. She enrolled in care management. He scheduled her appointment with the local Aging and Disability Resource Center, or ADRC. During the outreach, Mateo identified that Vanessa needed attendant care, home delivered meals, medication management, nutritional supplements, a personal emergency response system, and a rollator walker. He then immediately placed referrals for services. In April 2023, Mateo followed up with Vanessa's daughter and power of attorney, Alexis, who confirmed Vanessa and Alexis met with the ADRC for services and were pending approval. Alexis also reported Vanessa was successfully receiving medications from a pharmacy service. During this follow-up, a need for exterminator services was identified. By May 2023, Vanessa was approved for Medicaid waiver services and began to receive home health nursing, incontinence supplies, and physical therapy. Once again, this is not Florida. Her daughter, Alexis, was working to be hired by an agency to become Vanessa's paid caregiver. During a follow-up call in June 2023, Mateo learned that the exterminator had been out to Vanessa's home and Alexis was working as Vanessa's paid caregiver for 7 hours per day. During the follow-up call, a ramp was identified as a need for Vanessa. Mateo continues coordinating pending services of nutritional supplements, a ramp, and a rollator walker with the Medicaid waiver service coordinator on behalf of Vanessa and Alexis. And as of today, Vanessa still remains in her home and continues to age in place. So as I said in the beginning, Centene, we are very big about transforming the community one person at a time. We're still very much in a pilot phase of this program. However, we do have our one success story right now. And the beauty about this story is that not once was Vanessa relocated from her home. So we didn't have any hospitalizations for Vanessa. She didn't have to relocate and go stay with another loved one. She was able to remain in her home. And we attribute a lot of that to the care manager being as knowledgeable as he was to help coordinate services for her. All right, so conclusion. So basically what we spoke about today, we talked about the implementation of a dementia care curriculum for the care management team, how it helps members to age in place in the least restrictive environment. We here at Centene, we developed a hybrid internal certification program for our care management team members, and our care management team members felt that their knowledge on dementia care increased, as well as their capability to work with members living with dementia after completing the curriculum. All right, so here are some references. So we did information, and that's it. That brings us to the very, very end. So it's now open for questions and answers if you have any.